On behalf of my colleagues at Rush and Dr. Larry Goodman and Dr. David Ansell, I'm proud to be here with you tonight to celebrate the incredible work that's represented here and the work that is so intently focused on what we are most concerned about at Rush, and that is health equity. We talk about health equity, and you hear the term a lot, but I want to tell you what it means to us, because I sense that is what it means to you. If you've driven past the Rush building, you may notice some words that are prominently displayed across the side of the building, and it asks the question, who gets the chance to be healthy? And so whenever we talk about health equity, we don't let those words stand on their own. We say what we mean, which is everyone should have the chance to be healthy, to live their most full and productive lives. And it's obvious in a sense, and yet we know that because of structural inequalities, because of poverty, because of pervasive structural racism, people don't have the opportunity to live their healthiest lives. And it is not their individual behaviors, because we know that the health of groups of people is really shaped by the places that they live and work and play. And so we, together with you, are thinking about how do we impact these social factors? How do we make a difference in communities around the issues of unemployment, poverty, and those things that we know drive these unacceptable health inequities that we see? And you know that there is what David Ansell has termed a death gap in Chicago. That is more than 20 years difference between the life expectancy in the Loop and the life expectancy just a few miles to the west in West Garfield Park, Fuller Park, and other communities. And so for Rush, that means that we want to invest in community. We take great pride in the outstanding, excellent medical care that we deliver as an institution. And we know that medical care is not enough. It's important, it's necessary, but in a sense, insufficient. And so that work has manifested itself in some initiatives I'll tell you briefly about. You may have heard about the Sankofa Wellness Village. Have any of you heard about Sankofa?
No.
Well, I want you to know that if you drive to West Garfield Park on Madison, when you get to Kildare, you will see a beautiful new striking building, the Sankofa Wellness Village. It is the realization of a dream that people in that community had to really construct a vision. So the building, which is the Sankofa Wellness Center, has in it an Erie federally qualified health center. It has a YMCA with a full-size basketball court. It has a credit union, and it has Rush providing behavioral health as an anchor tenant. But it's part of a larger vision that includes a supermarket, an entrepreneurship center, an arts center, and really begins to step into this space where we recognize that we're there to support a community vision for well-being for the community. Make sure you get down to see it. Make sure you go past there. I'd love to think about how we can make sure that folks get inside the building. But that's an example of impacting the places where people live, work, and play. Another example is something called the Fillmore Laundry Linen. you know North Lawndale. North Lawndale is a community that was the place that Martin Luther King Jr. went with his family in 1966 to move into an apartment to exemplify and to make real to the rest of the nation the terrible conditions that people were living in because of residential segregation, the slums that were there. You know that in 1968, when he was tragically murdered, that community went up in flames. And so many of the resources left that community. But in partnership with the Staines Foundation and others, a previous baking soda factory, which was an unwanted land use, it was falling apart, has been converted into a laundry linen facility. Now, why is that important? Hospitals use a lot of laundry.
Yeah.
We at Rush were loading our laundry onto trucks and shipping it to Western Illinois. But now, we have a contract, the first contract with the laundry linen, a state-of-the-art facility that has been constructed. It is a beautiful facility, and it employs 100 people. They're making a living wage. Rush is saving $700,000 a year.
Wow, that's great.
Rush is saving 18,000 metric tons of emissions that were generated by sending these trucks. And so we recognize that there's an opportunity to invest in community in ways that are aligned with our mission. Those are just some examples, but I want to come back to where we are tonight. And I've learned about the history of the Oak Park River Forest Infant Welfare Society. And it's striking to me that the beginnings of this organization were based in health equity way before that term came into use. The fundamental idea that early start in life should not be affected by one's ability to secure clean and safe food is fundamental and powerful, and to have the organization continue to be guided by that true north is really inspirational to me. I want you to know. And now, as we understand that often the health of children is a bellwether for the health of communities, this approach that you've taken to consider the health of the whole child, to think about behavioral health, to think about the material needs of families, and to think about access to health care is a critical piece. It fills a critical gap. Many of you know that organizations like the National Academy of Medicine have published studies looking at how we address health inequities. The most well-known is a report called Unequal Treatment. In that report, they make the point that the first thing you have to do, the necessary thing, is provide access to health care. The rest of it is important, and what we said is we're thinking about the community, but filling the gaps for those who do not have access to care is our first priority, and that's what you're doing here. You're helping children and their families, and by so doing, you're dramatically improving the health of the community. When you provide health care, behavioral health, vaccinations, help people get access to nourishing foods when they're food insecure, all of these are critical inputs to not only to the children's lives, but also to the health of community. You may already know this, but it turns out that the health of children is a powerful driver of the health of adults. And that may seem quite obvious, but there's a lot of study that shows, for example, that people who are born low birth weight are more likely at age 60 to have diabetes. it's a direct dose-response relationship. We know that children who are exposed to adverse childhood experiences, that is childhood neglect or abuse, are far more likely to develop chronic diseases. And we know that lack of access to dental care and dental caries and poor dental health has an adverse impact on one's cardiovascular health, right? Through immune mechanisms and the like. So we know that the work that you're doing here in this beautiful facility is really about not only how we address the health of children now, but how we address the health of communities when these young people are adults. So we're looking down the road. And so we know that the interventions, oral health care, behavioral health, can attenuate any of those bad things, right? That we can prevent by providing care, and especially for those who are most vulnerable. So today, I'm a fan, I'm a friend, and I want you to count Rush as a partner. I believe, and we believe deeply, that the work you're doing is transformative, and it fills a critical gap for those who are at the margins and likely to fall through the cracks, but for the work you're doing. I'm proud because you're here and you're serving 3,000 children a year and working to reach even more. So I'm confident we have a backstop, a safety net, an oasis, so that children who are deserving of health, of good health, these young people who we know deserve the chance to be healthy and to live their full and most amazing lives, are being served here. And so I'm grateful that you've included me in this celebration. I'm grateful that you're here, and I look forward to this partnership continuing in years to come. Thank you.
I want to thank Dr. Rich for those incredibly inspiring words. It's so important. I have one or two comments to make, but before I make those, I want you to know we agree we're going to have a raffle for 2 wonderful dinners, and we agreed to sell only 50 tickets, and we haven't quite sold all those tickets. So if anybody wants it, the 2 restaurants are Monteverde in Chicago and Osteria Longue. So if you know those restaurants, they are top shelf and top tier, and you have wonderful experiences if your name is picked. So if you are interested, please see Lise or I don't know, Cam. I want to make one quick statement. So Dr. Rich and I met each other when I was at an organization called Equal Hope. Equal Hope was Rush's first effort to push healthcare outside the walls of its building and try to really drive better health outcomes for those in communities where health outcomes were disparate. And the original name of Equal Hope was called the Metropolitan Chicago Breast Cancer Task Force, and they were looking very narrowly at the continuum of care in breast cancer, from diagnosis to treatment to outcome. And there's something that was learned there in those early stages of Equal Hope's life that is very important. As we talk about health equity, and we talk about the many collaborative efforts that are happening across the west side of the city. When Equal Hope started, we spent 4 years where I like to say they did nothing other than meet with the people that were going to try to help, talk to the providers about what they needed to serve more people, and talk to some of the other peripheral services, such as the people providing mammograms and others. And the one thing we heard from the communities that we went into to try to help was, we're tired of people coming into our communities and telling us what we have to do differently to live better lives. Like, don't do that, because we shut down. And this phrase came out of those conversations. They said, nothing about us without us. And so I think it is very important, as we look to grow this clinic and the service that we provide, that we find more and more ways to include the families that we are reaching out to serve, because we will learn from them what their needs are, rather than us saying, we're gonna give you a nutrition program. Well, maybe that's a great thing, and maybe they don't need that, right? Maybe they need after-school tutoring. Maybe they need, some other service. So nothing about us without us it's catchy, it sticks in your head, but I think there are so many efforts across the west side of Chicago and stretching here into Oak Park that are impacting the health and well-being of entire communities. And we are on the precipice of being part of all of them. And so I'm very honored to hear Dr. Rich say he's here as a partner. And so we will continue to look for more and more ways that we can collaborate with these other organizations and other efforts to bring about better health outcomes for those that we serve most. With that said, thank you all for being here. If you're interested in buying a raffle ticket, Lise is around here somewhere. And if not, there's still plenty of food, there's some wine, and I hope you can stay for a while with us.